What's up everyone, this is Dr. Webb here. Thank you guys for watching this video. Make sure you subscribe. New videos coming every week. You don't want to miss them. For those who are new to the channel, my name is Dr. Antonio Webb, a 5th-year orthopedic surgery resident. In this video today, I'm going to be talking about one of the weightlifters' injury that she sustained here recently at a competition, and kind of my thoughts on it and how we as orthopedic surgeons would fix this type of injury or manage this type of injury. So there was a weightlifting competition, I believe it was in Georgia, where there was one of the weightlifters. She's a French weightlifter. She holds 6 French records. She's a 3-time silver medalist at the European Championships in 2015, 2016, and 2018. And she was in a competition recently where she was lifting, 76 kilograms, or about 167 pounds. And she was going up for the lifting the bar, trying to lift it over her head. And then when she was kind of halfway up, her arm kind of gave away, and she had immediate pain and she dropped the weight. So I just wanted to talk about her injury. There's some reports out that say she had multiple fractures of her arm, as well as that she dislocated her elbow. So to understand this, we should talk about some of the biomechanics of the bone. So there are different forces that can act on the bone, and depending on that type of force, the bone will fail in a particular manner. So in general, the bone is usually weakest in shear type injuries and strongest in compression. So, and when you have this much weight and you're placing that weight on a particular bone, the bending forces, weight itself from the particular weights can actually cause a moment arm that causes a fracture. So in this particular case where you're putting lots of weight on a particular bone, and the bone gets to a point where it cannot withstand those forces anymore, it fractures. So in her particular case, we can assume, I haven't seen any x-rays or any reports of what type of fracture that she had, but we can assume that she had what's called a transverse fracture. Transverse fractures are from compression of the bone, when there's a kind of moment arm and there's a bending portion. Convex side of the bone undergoes tension, and the concave side portion of the bone undergoes compression, and this is what leads to a fracture. So when we see a patient in the ER or in clinic and they have a fracture, sometimes we can tell what type of mechanism was responsible for that fracture. So, as we mentioned before, bone is weakest in shear or torsion. So when a kid comes in with a fracture or adult comes in with a fracture, and it's more of a shear type injury or torsion type injury, that usually produces a oblique or a less transverse type fracture. So when this happens, obviously, if there's a dislocation of any joint in the body, such as the hip or the knee or one of the fingers or the elbow, we try to get that back in as soon as possible, which means right there on the scene where it happens, if there's a physician there that can put that bone back into place, usually with the adrenaline, that helps with some of the pain, or you can give the patient some pain meds and try to get that joint back into place. Usually we do this by flexing the elbow up and then someone pulling counter pressure. Sometimes you can supinate the forearm, which means turning the hand up as if you're about to hold a plate of foods, and this usually allows the elbow to get back into place. Once the elbow is in place, we get x-rays to confirm that it's in place, and we look for any fractures. There's lots of associated injuries that you can have. You can damage the ligaments around the elbow. You can damage the bones on the anterior portion of the elbow, one particular bone called the cornoids. And depending on what associated injuries are present, that will dictate the kind of treatment that happens. If the patient doesn't have any fractures and it's just called a simple dislocation, not associated with any ligamentous type injuries, we can treat that patient in a splint or immobilization and let the soft tissues kind of rest and recover, and then start some motion. The elbow gets really stiff if you leave it in a splint or a cast or any type of mobilization too long. So that's kind of how we would treat a simple elbow dislocation. And then there's complex, which means there's associated injuries that are associated with it, and depending on those injuries, that's how we address it surgically in surgery, whether this means going in to repair the ligament that was torn that causes the elbow to dislocate, or fix any fractures that are present. In terms of forearm fractures, they could be all different types: transverse, oblique. You can have a butterfly fragment or a comminuted type fragment, which means there are a lot of different bone pieces. But depending on the type of fracture and where it's located, whether it's in the proximal portion, which means closer to the body, versus the distal portion of the forearm, closer to the hand, that will dictate what type of surgery and how we fix it. But in general, it's usually a combination of plates, metal plates, and then screws to put the bone pieces back into a position where it heals, and then the plates usually stay in for the rest of the patient's life, unless it causes problems, gets infected, etc. So that is kind of my thoughts on this. First, if she did have an elbow dislocation, we try to get it back into a appropriate position. And then the fracture of the forearm, depending on whether it's in the radius or the ulna, will dictate how we fix it. So this is kind of my thoughts on this injury, and I wish her a speedy recovery. It's a bad injury, and I hope this video explains her injury a little bit better, and help you guys understand kind of what exactly happened, and what we as orthopedic surgeons would do for her. So thank you for watching. Make sure you subscribe. New videos coming every week. We'll see you next time.